Hello, my name is Courtney Vargo, and I am going to be talking to you about Elizabeth R. Lenz's theory of unpleasant symptoms today. By understanding that many symptoms occur concurrently with other symptoms, the theory of unpleasant symptoms, referred to as TAUS throughout this presentation, was created in order to provide a better understanding of the relationships among symptoms. We all know a single symptom can occur on its own, but we also know that more often than not, symptoms occur in clusters that interact with and feed off of one another. By identifying these particular interactions and the patient experiences generated from them, further nursing research can be conducted in order to better manage these symptoms. Ultimately, more appropriate and timely patient interventions can be provided. TAUS impacts both nursing research and practice. TAUS is a middle-range theory since it contains relatively specific and concrete concepts. Its aim is to integrate knowledge applicable to individual symptoms in order to enhance symptom control and nursing care. TAUS was created specifically for use in nursing research and practice. Furthermore, TAUS can help develop preventative interventions for a variety of symptoms. So this theory can be viewed as a middle-range predictive theory as well. Symptoms are one of the most common reasons that patients seek medical attention. More often than not, patients are presenting with multiple symptoms. But having more than one symptom has negative effects on patient outcomes. This is because multiple symptoms usually make assessments, diagnoses, and treatments more challenging. As a result, the National Institute of Nursing Research has highlighted that knowledge regarding symptom clustering can improve management of patient illnesses. Consequently, TAUS was developed in 1995 by Elizabeth R. Lenz and colleagues to address these concerns of symptom management. At that time, Elizabeth Lenz and her team were more focused on individual symptoms. But the theory was since revised in 1997 to emphasize the idea that multiple symptoms usually occur simultaneously. Developed by a group of nurses, the theory is tailored to prepare nurses for better symptom management for their patients. There are three main concepts emphasized in TAUS. These are influencing factors, symptoms, and performance. Influencing factors are the factors that affect the occurrence, intensity, timing, distress level, and quality of symptoms. These can be physiologic, psychologic, or situational in nature. Physiologic factors include alterations in functioning of body systems. This would include things such as nutrition and sleep. Psychologic factors include an individual's mood and mental state. Situational factors include an individual's external factors, such as their support systems and their socioeconomic status. All of these influencing factors can have a direct effect on symptoms a patient is experiencing. The second concept is the symptoms themselves, which are defined as perceived indicators of change in normal functioning that a patient may experience. Symptoms are multidimensional, defined in terms of intensity, distress, timing, and quality. If multiple symptoms occur simultaneously, they can interact with one another. The last concept is performance. This constitutes the consequence of the symptom experience. This concept is directly related to quality of life and activities of daily living. TAUS allows for nurses to recognize characteristics of multiple symptoms, as well as the underlying disease cause. As a result, Lenz and colleagues propose that TAUS is clinically applicable to almost any patient interaction. TAUS allows nurses to consider factors that affect symptoms and how each component interacts with one another. It has been reported that TAUS has been especially beneficial in the emergency department to develop symptom scales for patients experiencing different cardiac conditions and also for COPD patients. Heart failure continues to be on the rise, with increasing life expectancy and an increasing number of patients with heart disease. Since there is no cure, heart failure patients require extensive symptom management. As nurses and nurse practitioners in a variety of healthcare settings are bound to interact with heart failure patients, it is an important topic to consider in order to enhance the nursing practice being given to these patients and their families. Heart failure is considered to be a pandemic due to its increasing prevalence. Heart failure affects an estimated 26 million people worldwide. In the United States, there was a 70% decline in the number of deaths attributed to heart failure from 1968 to 2011. But since 2011, there has not been a big change. That initial decline has been attributed to advances in management of heart failure over the years, but there is still a large number of patients struggling with heart disease, which can lead to heart failure and could lead to death. Close management is imperative to resuming this former decline in the number of heart failure-related deaths again. This topic is so important to help increase the quality of life of patients battling heart failure and to prevent their premature death. This project falls well within the realm of nursing. Nurses spend a tremendous amount of time in direct patient care. Among other conditions, it is imperative that nurses pick up on the symptoms of heart failure in order to provide more timely interventions. Also, having profound knowledge in clusters of heart failure symptoms, nurses can anticipate symptoms before they even occur, and this will help provide a more preventative approach. As a result, it is feasible for nurses to roll out a symptom management scale in order to better understand heart failure symptomatology, or a self-care model to help increase patients' self-care efficacy when battling heart failure. Other nursing researchers have tried to tackle this problem. In literature, symptom scales and self-care models have been researched to address issues surrounding heart failure. As a result, we know that it is not just healthcare workers that should recognize the symptoms of heart failure. Patients also need to be educated on worsening symptoms to look out for in order to know when to seek medical attention. We know that focusing on symptom management is key to decreasing heart failure mortality. For instance, one study developed a self-care model for patients in heart failure grounded in the concepts of the Taus theory. Symptoms were assessed based on 3 major concepts utilized in the theory, those factors that we talked about before, influencing factors, symptoms, and performance. A self-care, self-efficacy subscale was then developed to help assess patients' confidence in their ability to engage in self-care activities. The results showed that anxiety, depression, low social support, several unpleasant symptoms, low self-efficacy, and poor self-care was prominent in heart failure patients, and all of these factors must be accounted for. Additionally, unpleasant symptoms experienced influenced self-care in heart failure patients. This shows how imperative it is to manage individual symptoms in order for additional self-care activities to take place. This is a direct example of how the Taus model can help describe heart failure symptoms to predict when exacerbations may occur in order to intervene more promptly. Since heart failure management relies so heavily on symptom management as opposed to treatment, Taus is a great framework to be utilized for this project of decreasing heart failure-related deaths. By identifying all 3 concepts within the theory, once again, the influencing factors, the symptoms themselves, and the performance, the relationships between symptoms can be better understood to guide nursing practice and research. Symptom management requires more attention in the future. Research shows that clustering symptoms, such as with TAUS, offers a meaningful approach in symptom management that is grounded in evidence-based practice. This has already been explored in conditions for COPD and chronic kidney disease. For heart failure, TAUS can help guide nurses to create a heart failure symptom management scale. However, as opposed to maybe other scales utilized in the past, this scale should include all of the concepts embedded in the TAUS model in order to represent the total symptom experience that these patients are experiencing. And now knowing that so many of these symptoms feed off of one another, each one needs to be carefully considered. Consequently, we should see an improvement in patient outcomes. Thank you.